Hello, I am Dr. Bapuji, Chairman for Center for Integrated Medicine from Hyderabad, and today I am going to talk to you about blood pressure. What I see when I see my patients, everybody is worried about a little here and there if the BP fluctuates. What is blood pressure? When heart main chamber, which pumps to the whole body, when it contracts, it generates maximum pressure in that chamber and main vessels. That is measured as so many millimeters of mercury. And when heart relaxes, what is the resting pressure is known as diastolic pressure. Now 120/80 you must have heard, the BP normal reading which people have the impression. 120/80 reading is average reading for layperson or non-medical people to understand. So 120 is when the heart contracts, maximum pressure generated by the left ventricle, and heart relaxes. The 80 millimeters is resting pressure. Now we were taught long ago, 45 years ago, that it is the diastolic pressure more important. Systolic pressure, that is numerator, can go up. Suppose if you climb 4 stories quickly and come back, and if somebody checks your blood pressure, it can go up to 200 millimeters of mercury. Okay, and the 200 will come back to normalcy within 5 minutes of rest. Diastolic never goes up, because when you do physical activity, it is a systolic pressure. When you are angry, systolic pressure goes up. But what increases the lower reading, if you are constantly stressed up and tense and worried, and you don't know how to relax at that time, or if you have want to settle score with somebody, and then you are trying to plan to harm somebody or do loss in the business, and we face so many things in day-to-day life. It is your anger and your reaction that can push up even diastolic pressure, because adrenaline is constantly released during stress. Now everybody is trying to blame stress. Who doesn't have stress? Do you mean to say I don't have stress? It depends on how you take it. Now coming back to blood pressure, 120/80 is an average reading for layperson, but there is a range. Blood pressure throughout the day is not constant. When you have a good night's sleep and you take, if somebody takes blood pressure early in the morning, it can be 100/60 also. So lower limit of normal is 100/60. Upper limit of normal up to 160/90 also, if you are above 50 years of age, or 60, 70, up to 160/90 also we consider as normal. And at what blood pressure it can cause heart attack, it can cause stroke, there is no such thing. I have seen cases where at 120/80 also heart attack can occur, at 120/80 also paralytic stroke can occur. There is no limit. I have seen cases 160/90, a paralytic stroke occurs. So there is no hard and fast rule that this is the limit. Like in pressure gauge, there is no limit where the boiler will burst after that. So there is a red range, green range. Similarly in blood pressure also there is safe range they have given, and red range they have put. Beyond certain limit, yes, one has to take precaution, but universally nobody clearly knows what is the normal blood pressure for any individual, because I have seen cases where during the last 45 years upper reading was beyond 300. Any mercury BP apparatus or the dial type of ergometer and these instruments, upper limit is shown as 300. I have seen beyond 300. And the diastolic pressure was 160. And what we were taught was such cases should be referred to immediately intensive care unit. The first case, when I was Nature Cure Hospital superintendent long ago, about 25 years ago, 30 years ago, I referred the case to Gandhi Hospital, government hospital, teaching hospital. There the postgraduates brought the BP precipitously down to 120/80. Patient developed heart attack. She was a lady patient. Another case after 10 or 12 years, when I left Nature Cure Hospital and started sitting in our own clinic, I got a lean fellow, 56 years old. When he came, his BP was 300 plus and diastolic was 160. 160 is malignant hypertension, they call it. Malignant means life-threatening. Now I referred him to Nizam's Institute of Medical Sciences so that they can care with reference letter. There also same thing happened. The postgraduates who were on DT, they brought it down to 120/80. He developed a paralytic stroke. Since then, I never referred a case who comes with malignant hypertension. Now, how do you grade blood pressure? Now, systolic pressure can fluctuate every day on physical activity, stress, and I mentioned to you anger and so on. But diastolic pressure is the main pressure because there is a constant load on the main chamber of the heart. So if the diastolic denominator, if it is up to 90, you don't have to worry, you don't have to start medication, or doctor should not write. But because of commercialization, the physicians are writing 140/90. No, it can go up. Who will measure in the afternoon? Who will measure in the night? So better to start taking medication is what they advise, and write the medicines also. This is not correct. When do we declare a person as having blood pressure? If his reading is beyond 160/90 on 3 different occasions on 3 different days, then we declare him as mild blood pressure. So how do we decide mild, moderate, severe? Mild blood pressure means 91 to 104. The denominator is known as mild blood pressure. So what we do is we tell the patient, you have got mild blood pressure, you might require a small medication and reduce the intake of salty foods. And 105 to 114, we call it as moderate blood pressure. And 115 to 129, we call it as severe hypertension. And 130 and above, as I mentioned 2 cases, it is malignant hypertension. These are the categories of blood pressure. Please contact your local physician and leave it to him. Thank you.